Today, my topic of discussion is Parkinson disease. This is a progressive nervous system disorder that affects movement. Symptoms start gradually, sometimes starting with a barely noticeable tremor in just one hand. Tremors are common, but the disorder also commonly causes stiffness or slowing of movement. In the early stages of Parkinson's disease, your face may show little or no expression. Your arms may not swing when you walk. Your speech may become soft or slurred. Parkinson's disease symptoms worsen as your condition progresses over time. Although Parkinson's disease can't be cured, medication might significantly improve your symptoms. Occasionally, your doctor may suggest surgery to regulate certain regions of your brain and improve your symptoms. Now let me tell you the symptoms of Parkinson's disease. The signs and symptoms can be different for everyone. Early signs may be mild and go unnoticed. Symptoms often begin on one side of your body and usually remain worse on that side even after symptoms begin to affect both sides. Parkinson's signs and symptoms may include a tremor or shaking, usually begins in a limb, often your hand or finger. You may rub your thumb and forefinger back and forth, known as a pill rolling tremor. Your hand may tremble when it is at rest. And the other symptom is slowed movement, that is known as bradykinesia in our medical terminology. Over time, Parkinson's disease may slow your movement, making simple tasks difficult and time-consuming. Your steps may become shorter when you walk. It may be difficult to get out of a chair. You may drag your feet as you try to walk. Another symptom is rigid muscle. Muscle stiffness may occur in any part of your body. The stiff muscles can be painful and limit your range of motion. Impaired posture and balance. Your posture may become stooped or you may have balance problem as a result of Parkinson's disease. There could be loss of automatic movements. You may have a decreased ability to perform unconscious movements such as blinking, smiling, or swinging your arms when you walk. Speech changes. You may speak softly, quickly, slur, or hesitate before talking. Your speech may be more of a monotone rather than have the usual inflections. Writing changes. It may become hard to write and your writing may appear small. You should see your doctor if you have any of the symptoms associated with Parkinson's disease, which I have just described, not only to diagnose your condition but also to rule out other causes for your symptoms. Now let me tell you the causes. In Parkinson's disease, certain nerve cells, which are known as neurons in the brain, gradually break down or die. Many of the symptoms are due to loss of neurons that produce a chemical messenger in your brain called dopamine. When dopamine levels decrease, it causes abnormal brain activity, leading to impaired movement and other symptoms of Parkinson's disease. The cause of Parkinson's disease is unknown, but several factors appear to play a role. These factors, I should tell you, genes. Researchers have identified specific genetic mutations that can cause Parkinson's disease, but these are uncommon except in rare cases with many family members affected by Parkinson's disease. However, certain gene variations appear to increase the risk of Parkinson's disease, but with a relatively small risk of Parkinson's disease for each of these genetic markers. Environmental triggers. Exposure to certain toxins or environmental factors may increase the risk of later Parkinson's disease, but the risk is relatively small. Researchers have also noted that many changes occur in the brain of people with Parkinson's disease. Although it is not clear why these changes occur, these changes include the presence of Lewy bodies. Clumps of specific substances within brain cells are microscopic markers of Parkinson's disease. These are called Lewy bodies, and researchers believe these Lewy bodies hold an important clue to the cause of Parkinson's disease. Alpha-synuclein found within Lewy bodies. Although many substances are found within Lewy bodies, scientists believe an important one is the natural and widespread protein called alpha-synuclein. It is found in all Lewy bodies in a clumped form that cells cannot break down. This is currently an important focus among Parkinson's disease researchers. Now coming to the risk factors. Risk factors of Parkinson's disease include age. Young adults rarely experience Parkinson's disease. It ordinarily begins in middle or late life, and the risk increases with age. People usually develop the disease around age 60 or older. Hereditary. Having a close relative with Parkinson's disease increases the chances that you will develop the disease. However, your risks are still small unless you have many relatives in your family with Parkinson's disease. Sex. Men are more likely to develop Parkinson's disease than are women. Exposure to toxin. Or ongoing exposure to herbicides and pesticides may slightly increase your risk of Parkinson's disease. Now let me tell you the complications. Parkinson's disease is often accompanied by additional problems which may be treatable. These include thinking difficulties. You may experience cognitive problem, which is known as dementia, and thinking difficulties. These usually occur in the later stage of Parkinson's disease. Such cognitive problems are not very responsive to medications. Depression and emotional changes. You may experience depression sometimes in the very early stages. Receiving treatment for depression can make it easier to handle the other challenges of Parkinson's disease. You may also experience other emotional changes such as fear, anxiety, or loss of motivation. Doctor may give you medication to treat these symptoms. Swallowing problems. You may develop difficulty with swallowing as your condition progresses. Saliva may accumulate in your mouth due to slow swallowing that leads to drooling. Chewing and eating problems. Late stage Parkinson's disease affects the muscle in your mouth, making chewing difficult. This can lead to choking and poor nutrition. Sleep problems and sleep disorder. People with Parkinson's disease often have sleep problems, including waking up frequently throughout the night, waking up early, or falling asleep during the day. People may also experience rapid eye movement, sleep behavior disorder, which involves acting out your dreams. Medication may help your sleep problems. Bladder problems. Parkinson's disease may cause bladder problems, including being unable to control urine or having difficulty urinating. Constipation. Many people with Parkinson's disease develop constipation mainly due to a slow digestive tract. You may also experience blood pressure changes. You may feel dizzy or lightheaded when you stand due to a sudden drop in blood pressure that is known as orthostatic hypotension. Smell dysfunction. You may experience problems with your sense of smell. You may have difficulty identifying certain odors or the difference between odors. Fatigue. Many people with Parkinson's disease lose energy and experience fatigue, especially later in the day. The cause is not always known. Pain. Some people with Parkinson's disease experience pain either in specific areas of their body or throughout their body. Sexual dysfunction. Some people with Parkinson's disease notice a decrease in sexual desire or performance. Now let me tell you something about prevention. Because the cause of Parkinson's is unknown, proven ways to prevent the disease also remain a mystery. Some research has shown that regular aerobic exercise might reduce the risk of Parkinson's disease. Some other research has shown that people who consume caffeine, which is found in coffee, tea, and cola, get Parkinson's disease less often than those who do not drink it. Green tea is also related to a reduced risk of developing Parkinson's disease. However, it is still not known whether caffeine actually protects against getting Parkinson's or is related in some other way. Currently, there is not enough evidence to suggest drinking caffeinated beverages to protect against Parkinson's. So this is not 100% proven about caffeinated drinks. Okay. Now let me tell you about diagnosis of Parkinson's disease. No specific test exists to diagnose Parkinson's disease. Your doctor trained in nervous system condition, who is known as neurologist, will diagnose Parkinson's disease based on your medical history, a review of your signs and symptoms, and a neurological and physical examination. Your doctor may suggest a specific single photon emission computerized tomography, that is SPECT scan, called a dopamine transporter scan, also DAT scan. Although this can help support the suspicion that you have Parkinson's disease, it is your symptom and neurological examination that ultimately determine the correct diagnosis. Most people do not require a DAT scan. Your doctor may order lab tests such as blood tests to rule out other conditions that may be causing your symptom. Imaging tests such as MRI, ultrasound of the brain, and PET scan also may be used to help rule out other disorders. Imaging tests are not particularly helpful for diagnosing Parkinson's disease. In addition to your examination, your doctor may give you carbidopa, levodopa, that comes with the name of Rytary or Sanimet, which is a Parkinson's disease medication. This medicine can be not only used for treatment, it can be also used for diagnosis. You must be given a sufficient dose to show the benefit, as low doses for a day or two are not reliable. Significant improvement with this medication will often confirm your diagnosis of Parkinson's disease. So this medicine is also used to confirm the diagnosis. Sometimes it takes time to diagnose Parkinson's disease. Doctor may recommend regular follow-up appointments with neurologists trained in movement disorder to evaluate your condition and symptom over time and diagnose Parkinson's disease. Now coming to the treatment. Parkinson's disease cannot be cured, but medication can help control your symptoms, often dramatically. In some more advanced cases, surgery may be advised. Your doctor may also recommend lifestyle changes, especially ongoing aerobic exercise. In some cases, physical therapy that focuses on balance and stretching also is important. A speech language pathologist may help improve your speech problems. coming to the medication. Medication may help you many problems with walking, movement, and tremor. These medications increase or substitute for dopamine. People with Parkinson's disease have low brain dopamine concentration. However, dopamine cannot be given directly as it cannot enter your brain. You may have significant improvement of your symptoms after beginning Parkinson's disease treatment. Over time, however, the benefit of drug frequently diminish or become less consistent. You can usually still control your symptoms fairly well. Medication your doctor may prescribe include: first drug, which is most commonly used, is carbidopa-levodopa combination. Levodopa, the most effective Parkinson's disease medication, is a natural chemical that passes into your brain and is converted to dopamine. Levodopa is combined with carbidopa that comes with the name of lodocin. The combination name is lodocin, which protects levodopa from early conversion to dopamine outside your brain. This prevents or lessens side effects such as nausea. Side effects may include nausea or lightheadedness, that is orthostatic hypotension. After years, as your disease progresses, the benefit from levodopa may become less stable with a tendency to wax and wane, that is wearing off. Also, you may experience involuntary movement, that is dyskinesia, after taking higher doses of levodopa. Your doctor may lessen your dose or adjust the time of your dose to control these effects. Another option is inhaled carbidopa-levodopa. Inbrija is a new brand name drug delivering carbidopa-levodopa in an inhaled form. It may be helpful in managing symptoms that arise when oral medications suddenly stop working during the day. Carbidopa-levodopa infusion is also available. This comes with the name of Duopa. This is a brand name medication made of carbidopa and levodopa. However, it is administered through a feeding tube that delivers the medication in a gel form directly to the small intestine. Duopa is for patients with more advanced Parkinson's who still respond to carbidopa-levodopa, but who have a lot of fluctuation in their response. Because Duopa is continually infused, blood levels of the two drugs remain constant. Placement of the tube requires a small surgical procedure. Risks associated with having the tube include the tube falling out or infection at the infusion site. Another drug, which is group of drug, is dopamine agonist. Unlike levodopa, dopamine agonists do not change into dopamine. Instead, they mimic dopamine effects in your brain. They are not as effective as levodopa in treating your symptoms. However, they last longer and may be used with levodopa to smooth the sometimes off and on effects of levodopa. Dopamine agonists include pramipexole, that is come with the name of Mirapex, ropinirole, that comes with the name of Rekip, and rotigotine, that comes with the name of Nupro, which is given as a patch. Apomorphine, that comes with the name of Apoquine, is a short-acting injectable dopamine agonist used for quick relief. Some of the side effects of dopamine agonists are similar to the side effects of carbidopa-levodopa, but they can also include hallucinations, sleepiness, and compulsive behavior such as hypersexuality, gambling, and eating. If you are taking these medications and you behave in a way that is out of character for you, you should talk to your doctor. Another group of medicine is MAO-B inhibitors. These medications include salicyline, that comes with the name of Zalapar, and rasagiline, that comes with the name of Azilect. And they help prevent the breakdown of brain dopamine by inhibiting the brain enzyme monoamine oxidase B. This enzyme metabolizes brain dopamine. Salicyline given with levodopa may help prevent wearing off. Side effects of MAO-B inhibitors may include headaches, nausea, or insomnia. When added to carbidopa-levodopa, these medications increase the risk of hallucinations. These medications are not often used in combination with most antidepressants or certain narcotics due to potentially serious but rare reactions. Check with your doctor before taking any additional medication with an MAO-B inhibitor. There is another group of drugs, that is catechol or methyltransferate, that is COMT inhibitors, and entacapone, that comes with the name of Comtan, is the primary medication from this class. This medication mildly prolongs the effect of levodopa therapy by blocking an enzyme that breaks down dopamine. Side effects including an increased risk of involuntary movements, that is dyskinesia, mainly result from an enhanced levodopa effect. Other side effects include diarrhea, nausea, or vomiting. Tolcapone, that comes with the name of Tesmor, is another COMT inhibitor that is rarely prescribed due to risk of serious liver damage, and liver failure. There's another group of drug which is anticholinergics. These medications were used for many years to help control the tremor associated with Parkinson's disease. Several anticholinergic medications are available, including benztropine or triacylphenidal. However, their modest benefits are often offset by side effects such as impaired memory, confusion, hallucination, constipation, dry mouth, and impaired urination. Amantadine. Doctor may prescribe amantadine alone to provide short-term relief of symptoms of mild early-stage Parkinson's disease. It may also be given with carbidopa-levodopa therapy during the later stage of Parkinson's disease to control involuntary movements, that is dyskinesia induced by carbidopa-levodopa. Side effects may include a purple mottling of the skin, ankle swelling, or hallucinations. Now let me talk a little bit about surgical procedure that is known as deep brain stimulation. In deep brain stimulation, surgeons implant electrodes into a specific part of your brain. The electrodes are connected to a generator implanted in your chest near your collarbone that sends electrical pulses to your brain and may reduce your Parkinson's disease symptoms. Your doctor may adjust your setting as necessary to treat your condition. Surgery involves risk including infection, strokes, or brain hemorrhage. Some people experience problems with the DBS system or have complications due to stimulation, and your doctor may need to adjust or replace some parts of the system. Deep brain stimulation is most often offered to people with advanced Parkinson's disease who have unstable medication responses. DBS can stabilize medication fluctuation, reduce heart involuntary movements, reduce tremor, reduce rigidity, and improve slowing of movement. Deep brain stimulation is effective in controlling erratic and fluctuating responses to levodopa or for controlling dyskinesia that does not improve with medication adjustment. However, DBS is not helpful for problems that don't respond to levodopa therapy apart from a tremor. A tremor may be controlled by DBS even if the tremor is not very responsive to levodopa. Although DBS may provide sustained benefit for Parkinson's symptoms, it does not keep Parkinson's disease from progressing. So you should keep this thing in mind. Now let me tell you some of the lifestyle and home remedies. If you have received a diagnosis of Parkinson's disease, you will need to work closely with your doctor to find a treatment plan that offers you the greatest relief from symptoms with the fewest side effects. Certain lifestyle changes may also help make living with Parkinson's disease easier. First is healthy eating. While no food or combination of food has been proved to help in Parkinson's disease, some food may help ease some of the symptoms. These foods are not curative. These can ease some symptoms. For example, eating food high in fiber and drinking an adequate amount of fluids can help prevent constipation that is common in Parkinson's disease. A balanced diet also provides nutrients such as omega-3 fatty acids that might be beneficial for people with Parkinson's disease. Second comes exercise. Exercise may increase your muscle strength, flexibility, and balance. Exercise can also improve your well-being and reduce depression or anxiety. Your doctor may suggest that you work with a physical therapist to learn an exercise program that works for you. You may also try exercises such as walking, swimming, gardening, dancing, water aerobics, or stretching. Parkinson's disease can disturb your sense of balance, making it difficult to walk with a normal gait. Exercise may improve your balance. These suggestions which I am going to tell you may help you. You should try not to move too quickly. Aim for your heel to strike the floor first when you are walking. If you notice yourself shuffling, stop and check your posture. It is best to stand up straight. Look in front of you, not directly down while walking. You should avoid falls. In the later stage of the disease, you may fall more easily. In fact, you may be thrown off balance by just a small push or bump. And here are some suggestions which can avoid falls. Okay. First of all, make a U-turn instead of pivoting your body over your feet. Distribute your weight evenly between both feet and do not lean. Avoid carrying things while you walk. Avoid walking backward. Daily living activities such as dressing, eating, bathing, and writing can be difficult for people with Parkinson's disease. An occupational therapist can show you techniques that make daily life easier. And now I'll tell you something about alternative medicine. Supportive therapies can help ease some of the symptoms and complications of Parkinson's disease such as pain, fatigue, and depression. When performed in combination with your treatment, these therapies might improve your quality of life. The first thing is massage. Massage therapy can reduce muscle tension and promote relaxation. This therapy, however, is rarely covered by health insurance. Tai Chi, an ancient form of Chinese exercise. Tai Chi implies slow flowing motion that may improve flexibility, balance, and muscle strength. Tai Chi may also help prevent falls Several forms of Tai Chi are tailored for people of any age or physical condition. A study showed that Tai Chi may improve the balance of people with mild to moderate Parkinson's disease more than stretching and resistance training. Yoga. In yoga, gentle stretching movements and poses may increase your flexibility and balance. You may modify most poses to fit your physical abilities. Alexander technique. This technique, which focuses on muscle posture, balance, and thinking about how you use muscle, may reduce muscle tension and pain. Meditation. In meditation, you quietly reflect and focus your mind on an idea or image. Meditation may reduce stress and pain and improve your sense of well-being. Pet therapy. Having a dog or cat may increase your flexibility and movement and improve your emotional health. Well, this is a long topic, but I covered most of the topic which is necessary for a Parkinson patient. If you suffer from Parkinson's disease or any other disease, please post your comments about the illness, and I'll try to reply to your comment as soon as possible. And if you have any other disease, please write in the comment section of this video, and I'll try my best to make a video on your illness. Okay.